Usatine Media presents Essential Clinical Procedures. This is an app that will help you do all of the clinical procedures that are essential to the practice of being a physician's assistant, a nurse practitioner, a physician. It's got many procedures, and currently what we're doing is we're just going through the table of contents and seeing what areas there are to review. If we wanted to treat a ingrown toenail, we could go to this particular section and learn about the anatomy of the nail and how you would cut the nail so that you don't have to cut the whole toenail off for an ingrown nail. You just need the lateral portion, which will be removed. And this procedural app will explain to you how to do that. If you go to the text, you can actually get a description of how this is done and how you would ablate the nail matrix, things using phenol, and it's a good procedural guide. There are many ways to go through this besides the contents. You can do a search. Let's say you needed to sew up a laceration. You can click on laceration, get a lot of information about wound closures, and everything from just the anatomy of the skin to the skin tension lines to the kinds of needles one uses and the basics of just doing a simple interrupted stitch to the more complex suturing and actually doing a dog ear repair, or what's also called a standing cone. You can go to the text on this and learn more about how you do this. They're calling it a dog ear deformity. Okay, we can jump around also within a section like this. So if we want to find out, like say classification of wounds, we could go straight to that area. How you just determine between what's clean, contaminated, infected, all these areas, and different types of classifications even of the closure. So just a lot of good information along with the images. As we can go back to here, if we've created bookmarks, we can go to the bookmarks that we've created, bookmark text, images, tables, all kinds of areas that can be bookmarked for easy return to things that you've looked at before. Here is something on a sterile technique. You can also write a note if you want about, like, say, maybe, don't need sterile gloves for an I and D, something like that, I and D, because you're obviously dealing with an infected area anyway, so sterile gloves don't help. But you might want to make a note about something like that. So we have our bookmarks, we have our search. Here we search something that was already searched before, but if we're going to start with a search, and let's say we have, let's see what other kinds of clinical procedures. Maybe we would need to do an arterial blood draw, so we could we start typing, we get arterial, and here's the arterial puncture, and we can learn all about how to do the arterial puncture, various different locations for the puncture sites, and how to actually do the needle insertion. A lot of the images come from other excellent resources like the Fenninger Procedures for Primary Care Physicians, another app that we have created for you, and another option for a procedural book. So you've got both options, and you can look for the additional places where that word arterial occurs. We can also even go back to jumping within an area. So there's so many ways to navigate this. What's wonderful is you have this whole app either on your smartphone or on your tablet. Very light, of course, to carry because you're already carrying the phone with you, and very quick to find answers on all kinds of things, even flexible sigmoidoscopy, endometrial biopsies. Excellent, excellent images here. The anatomy, how to set up the tray, and then actually how to do that procedure using a pipelle, which is actually my favorite technique for the endometrial biopsy. And here's a Novak curette, another option. So really full of good pointers. So let's go back here. In addition, if we go to the About section here, we can learn more about how to use the app, about Elsevier, which is the publishing company, contact support, rate the app, learn more about the apps that we have created with Usatine Media. And you can see that we've developed this. I'm Dr. Usatine, and our lead software developer is Peter Erickson, and it's been a pleasure developing this app for you. I hope you find it useful in your practice, and thank you for your time.